Today I'm going to give an overview of the staph infection known as MRSA. MRSA is a type of staph bacteria found on the skin and in the nose that is resistant to many antibiotics, making treatment exceptionally difficult. It was first discovered in the 1880s. The bacteria cause painful skin and soft tissue conditions, such as boils and scalded skin syndrome. In the 1940s, medical treatment with antibiotics became routine and successful, but misuse and overuse aided bacteria evolution by helping the microbes become resistant. The bacteria became resistant to penicillin, thus methicillin was introduced. In 1961, scientists identified the first strains of bacteria that were resistant to methicillin, and these bacteria are now known as MRSA. Today, MRSA is resistant to all penicillin-like antibiotics, and it continues to evolve every day. There are over 90,000 cases diagnosed in the U.S. each year, and 18,000 of those result in death. There are two types of MRSA. The most common is healthcare-associated MRSA, and this is seen in hospitals and nursing homes. The reason for this is because suppressed immune systems and open wounds from surgery or injury can harbor bacteria. The other type of MRSA is community-associated MRSA. This is seen most often in public settings such as locker rooms, schools, and gyms. It can spread through skin-to-skin contact and also through sharing of personal items. In the early stages, the infection will show small red bumps that appear as pimples, spider bites, or boils. This can be red, swollen, painful, or warm to the touch, and can have a low-grade fever associated with it. If the infection is not treated, the smaller infections will turn into deep abscesses that are filled with pus and drainage. This can cause headaches, a general sick feeling, muscle aches, shortness of breath, fatigue, fever, shivering, and chest pain. If the infection continues to increase, it can go into the bloodstream and cause septic shock. If it reaches the bloodstream, it can cause a lot of different infections throughout the body. After MRSA affects the skin, it can enter the bloodstream and affect all cells, tissues, and organs in the body. For example, if the bacteria reach the heart, they can cause cardiac arrest or cardiovascular diseases. If they reach the brain, they can cause swelling and progress into meningitis. In the lungs, they can cause pneumonia. So virtually, this bacteria can affect every single part of the human body. MRSA infections can be extremely difficult to treat because of their resistance to antibiotics, but if they are caught in the earlier stages, the treatment is easier. So antibacteria treatment is the most common therapy, but it can be really difficult because of the resistance. Normally, a combination of different antibiotics are used to treat the infection. If that doesn't work, sometimes surgery is recommended. Sometimes the removal of IVs, artificial heart valves, or pacemakers may be necessary because bacteria tends to harbor in some of those places. In order to prevent MRSA in the healthcare setting, if a patient does show signs of the infection, they are immediately moved to isolation. Personal protective equipment is required for anyone that enters the room, and strict hygiene must be practiced. In the community setting, to prevent MRSA, frequent hand washing is really important, making sure that personal items are kept personal, Even sharing towels or clothing can spread the infection. And just practicing good hygiene measures, showering, bathing, that helps as well. So in conclusion, the infections can range from minor to life-threatening. They can affect all the systems of the body. Irreversible consequences can arise without proper treatment. This includes infections of the brain, heart, spinal cord, the vital organs of the body. Later stages can be dangerous because the resistance to antibiotics can be difficult. It can be difficult to treat the infection. And then it is important for everyone to practice precautionary measures and to be educated on the infection itself and how it can be spread from person to person.